Hi, we're here with Marco today, and Marco, can you tell me the type of symptoms that you were having prior to your neuromuscular dental treatment?
Well, I used to have popping and clicking on my jaw joints, jaw stiffness, limited open of the jaw, mouth did not open straight, pain when chewing, pain in the jaw joints, unstable bite, feels like my bite wasn't always changing, headaches, facial pain, numbness, neck pain, shoulder pain, back pain, ringing in the ears, difficulty swallowing, and pain in, on the eyeballs.
Yeah, pain behind the eyes, felt like?
Pain behind the eyeballs, yeah.
Okay. And your bite, it felt unstable, like it wasn't always going to the same place, it would go to different places all the time?
Yes, it did go to different places, and that makes me feel uncomfortable and painful.
Okay, okay. So now, I told you about the September 2010 letter to the American Dental Association by Dr. Greene. He said that TMJ is a psychological problem. What would you say to that?
Well, you know, when I wear my orthotic, my pain goes away. It makes a huge difference. And when I take it off, I get those symptoms back, and it's not nice. And you know, I have to wear them. I have to wear them all the time, and if I don't wear my orthotics, I don't think it's psychologically you know, a problem. It's something that we can see and feel.
So if it was psychological, the orthotic wouldn't make the pain go away? Is that what you're saying?
Yeah, exactly.
What do you think about Dr. Greene saying TMJ is best treated by giving the patient drugs?
Well, drugs treat the symptoms, not the problem. The orthotics treat the problem. And when I wear the orthotics, the pain, I don't need the drugs. With my orthotics, the pain goes away, and that's all I can say.
So the next thing Dr. Greene said is that if left untreated, TMJ will go away by itself. What do you think of that statement?
Well, I've been suffering for that problem for more than 7 years, and I've been...
and over that time?
And over that time, my problem is getting was getting worse and worse and worse. Since I've been wearing the orthotics, it's been a huge difference, and it's for good.
And so what do you think if you didn't wear the orthotic, after your 7-year experience of the pain getting continually worse, if you didn't have an orthotic, do you think it would spontaneously go away all by itself?
No way.
No way, okay. Okay, so the last thing that Dr. Greene said was he said that the computers like the K7, they don't work and they are not helpful in diagnosing or treating TMJ problems. Now, you're a unique person because you actually had a neuromuscular orthotic made by a dentist who didn't have a K7. And then you had a neuromuscular orthotic, a completely different orthotic made with the K7. So you can really speak to whether or not the K7 was helpful in diagnosing or treating your TMJ problems. So what would you answer to Dr. Greene as far as him saying the K7 doesn't really work?
Well, with the K7 computer system, I could see exactly where my jaw was supposed to go, and he showed me, and I understood that my jaw was out of place. So with that, we did a lot of work on that, and because of that computer, the K7, it's really working. It's really working. It's a lot of difference.
So what would you say is the main difference between the orthotic that was made with just the 10s and the orthotic that was made with the K7? Just as far as what you felt like when you wear those two. If I gave you those two different orthotics, and you wore one, and then you wore the other, what would you say the difference is?
The difference is that yeah, maybe it did some.
The one with just the tens?
The tens. Maybe it did some good, but not good enough because I couldn't understand where my muscles, all my jaw was supposed to go. And with that was with the tens. And with the K7, you can see and understand the problem. And it was the orthotic that it was made because of that machine. Now I feel a lot better, maybe 60% better, 70% better. Actually.
Than just wearing the tens?
Just wearing the tens, yes.
Okay. And how much a percent better from wearing nothing at all, from before we started? How much better are you now, percentage-wise, from nothing?
80%.
80%.
And I'm getting better all the time.
Okay. Thank you very much. You've been very helpful.
I'm not taking any medicine anymore.
What kind of medicines were you taking before?
I used to take naproxen when my pain was so bad. So that's what I was used to take to relax my muscles.
Thank you.